Hello, thank you so much for joining us today for the new PSYCKES features from our latest release, which just happened earlier this month. My name is Kristen McLaughlin, and I'm the Medical Informatics Director on OFI for the PSYCKES application, and I'm joined today by my colleagues Rachel and Jane, who will be assisting me in answering any questions that come up during today's training. So let's talk about how to answer or ask questions. I'll answer them. So as you might have noticed, all your phone lines have been muted to prevent background noise, but if you do have a question during today's training that you'd like to have us discuss, please access the Q&A box in the WebEx menu at the right of your screen, or if you've expanded the view of the webinar to your full screen, you'll just need to hover the cursor over the bar at the top of the screen to see the menu. You'll just need to type in your questions using the Q&A feature and submit that to all panelists, which is the default. And we ask for folks to please do not use the chat function for Q&A, as that will not be monitored. And today's slides, as well as the recording, will be sent to our users and attendees after today's training webinar. And we'll also make sure to post that online. So if you had a colleague who was unable to make today's training, they can also listen to it online. All right, so let's talk about today's agenda. So we'll start, like we do all of our webinars, with a brief PSYCKES overview, and then we're going to go into depth about some of the new features that we were able to add to the application during this most recent refresh, and that's including the social determinants of health section to the clinical summary. We also had a reorganization of the indicator sets in the MyQI report. We also have added additional quality indicator sets for the vital sign dashboard for both the adult and child population. We also have the core eligibility message included in the report filters, as well as the clinical summary. We also have crisis services for the intellectually and developmental disabled population, which will be available in report filters, as well as the clinical summary. We've added a new region filter to the recipient search. And then lastly, we had some really great updates for our iOS mobile app. And for that, we'll actually have a live demo to demonstrate. And then we'll end with training and technical support. So throughout the training, we'll be sure to pause and see if there are any questions throughout. But as I mentioned before, if you do have a question, please feel free to utilize the Q&A chat box. All right, so let's start with the PSYCKES overview. So what is PSYCKES? So PSYCKES is a secure and HIPAA-compliant online application that's meant for sharing data, including the Medicaid claims and encounter data, as well as other state administrative data. So what does PSYCKES do with this information? It puts into a user-friendly format in order to design the support of data-driven clinical decision-making, as well as care coordination and quality improvement. And as most of our users are probably aware, we have ongoing data updates. So information in the clinical summary, for instance, that's updated on a weekly basis, whereas our quality indicator reports are updated on a monthly basis. So who of my clients would be viewable in the application? So currently we have over 11 million of the New York State Medicaid enrollee behavioral health population, and that's including both currently or previously enrolled, and that's also including the fee-for-service claims, the managed care enrollees for all product lines, and those who are considered dual eligible. So what does that mean, dual eligible? So that can mean a couple different things. So for example, the Medicaid and Medicare population, so someone who's dual eligible who has both coverage will be able to display the Medicaid information, but unfortunately at this time we wouldn't be able to display the Medicare details. So for example, in the pharmacy or the medication section, you might notice for someone who is dual eligible for both Medicaid and Medicare that there might be some gaps there. Because if it's paid for by Medicare, unfortunately, we're not able to see it. However, we are working on adding that as a data source in the future. And as you know, folks are probably aware, we are constantly adding new data sources. And on my next slide will go into a couple of those examples. I also mentioned being part of the behavioral health population for the Medicaid enrollees. So what does behavioral health population mean? That means that the person has had a history of either a psychiatric or substance use service, a psychiatric or substance use diagnosis, or has been prescribed a psychotropic medication. But just because the behavioral health population are the ones that will be captured doesn't mean that the information about them is going to be limited to behavioral health. My next slide goes into more detail about that. All right, so what data is going to be available in PSYCKES? So we have, as the clinical summary has up to 5 years worth of information for one single person, and that's updated on a weekly basis. And we have 2 different buckets in which we consider our data sources. So our largest is going to be the Medicaid information. So that's the fee-for-service claims and the managed care encounter data, and that's across the treatment setting. So that's going to be information about folks' medications, their medical and behavioral health outpatient and inpatient services, ER utilization, care coordination, residential, labs, even more. Something to keep in mind when you are thinking about Medicaid, it is our largest data source, but also there are timelines to be aware of when we're thinking about this particular data source. So for things like, the medications, we actually think of those as pretty quick and timely from the time that the person picked up their prescription in the application to the time in which we were able to display it in the application is anywhere between 30 to 45 days. And oftentimes prescriptions are picked up in that, on a monthly basis, right? So that makes a lot of sense that we'd be able to display that, and it's considered more timely. However, things like outpatient and inpatient services, for whatever reason, it takes a little bit longer, right? So that could be anywhere between 3 or 4 months. Again, I've seen it for a little bit less, and I've also seen it for a little bit more. And that's going to depend on a few different things. So the first thing it's going to depend on is how quick and timely the providers themselves are billing for their services. So for example, if there's a provider who doesn't submit their bill until the end of the month, but a service occurred at the very beginning of the month, that's adding 30 days already to that claim. Also, if it's not adjudicated and gets sent back to the provider, that's another example of how a lag can expand. So once the provider submits accurately and timely to the managed care plan, the managed care plan then has to review and then submits to the Department of Health. So it really depends on how quickly and efficiently each of these different organizations are able to submit their information and these claims information. But once they have submitted and it goes to the Department of Health, that's where we're getting our weekly feed from. So that's just a little bit of an example of our Medicaid information and things to be aware of. Another thing that we have, or another bucket, is considered the state administrative databases. So what do we mean by that? So that is going to be all of these different databases that aren't based on claims, that are based on these different data sources that we have, and we consider those our real-time data sources, which means the lag there is anywhere between 0 and 7 days. And when we think about the clinical summary being updated on a weekly basis, that's why we consider those real-time. So for example, what are some of our real-time data sources? So we have the New York City Department of Homeless Services. So if someone has had a stay in the city's shelter or are in outreach for DHS, that information is going to be available in the application. We also have the Health Home Enrollment and Care Management Agency provider information, and we're getting that from the MAP database. We also have managed care plan and HARP status. We have the managed care plan assigned PCP. We have the State Psychiatric Center EMR called MARS. We have the AOT provider contact information, the ACT provider contact information, as well as any OMH housing that's not paid for by Medicaid. We're capturing that via CARES. We also have suicide attempt information. And the interesting thing about this is that this is not going to be privy to that 5-year look back like claims information is, right? So if someone or if a provider has reported a suicide attempt for someone in the state's incident management system called NIMERS, if they submitted that 5 years ago, 10 years ago, 12 years ago, if it's available there, we're able to pull that into the application. So you're not going to have that limitation of a 5-year look back in that regard. We also have safety plan screenings and assessments entered in by providers into either PSYCKES My Choice or our iOS application, and then intensive mobile treatment and AOT referral under investigation from DOHMH sources. So as you can see, we integrate all of these different data sources into one place for our users. Then we have our quality flags. So PSYCKES identifies a number of quality concerns in order to inform treating providers or networks to support clinical review and quality improvement. So if there's an issue with medication adherence or treatment engagement, an individual could be flagged, and that could let the provider as well as the network know what the issue is and how they could potentially support. When a client has an applicable quality flag, one of the things that they are able to do as a provider user is that you're allowed access to that individual's clinical summary. You're not going to have access to all available information as you would if you had a consent in place, but this does allow you to have information to the clinical summary, just doesn't include the enhanced protected health information. Here are some examples of some of the current quality flags that we do have in the application. So the no diabetes monitoring for individuals with diabetes and schizophrenia. We have low medication adherence for individuals with schizophrenia. We have no follow-up after mental health inpatient within 7 days or within 30 days. We have high utilization of inpatient and emergency room, hospital readmission. And then we also have things in regards to the health, home, and care management agencies in regards to the HARP enrolled, not assessed, or HARP enrolled and not health home enrolled. So I'm just going to pause here and check in with Rachel to see if there are any questions at this time.
Hi, this is Jane, but there are no questions at this time.
Hi, Jane. Thanks so much. So we do have Jane and Rachel who are assisting me in answering questions today. So just in case there are some folks who might have joined a little bit late, if you do have a question, we do ask you to use the Q&A feature within the WebEx, and you can submit your question there, and we'll be sure to stop periodically throughout the training webinar to address any questions that come in. And then, of course, we will be making sure that we are sending the slides as well as the recording to all of our attendees today. All right, so let's get a look at some of these new features. So let's start with the social determinants of health. So the social determinants of health, also known as FDH, this section was added to the clinical summary. And the data source for this information is coming from the Z codes and Medicaid billing. So at this time, it's only going to be from the data source of Medicaid claims. But we're hoping, again, as we've been discussing, we've been adding data sources as often as we can, so we hope to expand this in the future. So what are these social determinants of health going to include? So this is going to be societal or environmental conditions that can impact a wide range of health risks or outcomes. So here are some examples that would be for food insecurity, inadequate housing, problems related to education, employment, et cetera. So this information would be available now in the clinical summary. So users can select, so if one of the clients does have a specific social determinant of health listed in their clinical summary, they would be able to select that specific FDH to view more details, such as when was the date of service that this social determinant of health was provided via this claim? What was the service type? What was the service subtype? What was the provider's name? And then if there are any other primary, secondary, or quality flag related diagnoses. So let's take a look at some of the domain categories. So we have the conditions, those are like the individual conditions, but then we have these buckets, those domain category buckets in which those conditions belong into. It's very similar to what we do with our quality flags, right? We have a quality flag bucket and then indicators that belong in that indicator set. Same thing with the social determinants of health. So here you can see a list of the categories that we have, and it's from a wide arrangement of categories. So you see that we have problems related to education and literacy, employment, unemployment, occupational exposure, physical environment, housing and economic circumstances, social environment, upbringing, other problems related to primary support group or family circumstances, problems related to certain psychosocial circumstances or other, persons encountering health services for other counseling and medical advice, problems related to medical facilities, and personal risk factors. So these are our first 13 domain categories in which a condition could belong to. So here's a look at what the brief clinical summary will look like if someone has had a social determinant of health provided to them in the past year via a claim. So here in the brief, we're only going to limit it to the past year, but you'll see if you expand out to the 5-year, it'll go a little bit further. So here are the domain categories, and then here's the individual condition. And we separate each of the conditions via this dot in between. So here you can see that this person has a number of social determinants of health related to their housing and economic circumstances, and those are all listed here. If we switch over to the 1 or the 5-year view, you'll see that there's a social determinants of health set, and within that set, you would be able to see, and this is going to be listed right beneath the alerts and right above the quality flag. So if you're trying to figure out where in the clinical summary this would be listed, that's where. So if you decide, I want to know what John Doe's unsheltered homelessness, I want to know who provided him this specific social determinant of health. So I can click on this, and very similar to how we have the information for diagnoses, if folks are aware of that, that's what we have here. So it gives you the unsheltered homelessness information in regards to the date of service, the service type, the service subtype, the provider name, and then here you'll see the social determinant of health listed along with any other primary, secondary, and quality flag related diagnoses. All right, so that's the social determinants of health. Let's talk about the reorganization of the MyQI report. So this has now been divided in order to assist our users in helping them to identify more easily what the quote unquote real-time measures are versus the mature measures. So we have our quote unquote real-time measures, and those are known as the quality improvement indicators. And these are considered more real-time and are run on a monthly basis as of the refresh. So currently, our information is as of February 1st. And that's the information that we have in the application. So what we want to do next is talk about the performance tracking indicators. So those are considered more mature data and are calculated monthly after a 6-month maturation period to allow for services to be invoiced. And that's what often DOH does with many of their measures, is they have added on to the 6-month data maturation period to make sure that all of the services or all of the medications have definitely come in, because as we were talking about before, there are lags with that information. Whereas the quality improvement indicators don't have that 6-month lag, but may be considered more actionable. So this change, this division, is going to be reflected in the statewide reports as well as the client level clinical summary quality flag section. And then this is something I do want to mention. So we also had to rename a couple of our indicator sets. So the BH-QAR DOH performance tracking measure set was renamed the MH performance tracking measure, and the substance use disorder set was renamed to the SUD performance tracking measure. Now, folks might have noticed that in this release that these two indicator sets have been hidden in the MyQI report. And the reason for that is that we are in the process right now of adding new DOH measures into these sets. So we had to hide them for 1 month to add new measures into the sets. But once those are finished adding, we should have these back and available in the application for our March release. So that's just something to keep in mind, that these and these two will belong under the performance tracking indicators. And that was announced during our refresh notice. So here's a view of what this looks like. So here we're seeing the quality improvement indicators are now up at the top of this list, and we can see that this has been highlighted in a blue box. So this is what you can see from left to right. These are all the indicators that are considered the real time, quote unquote. whereas below, that's where the performance tracking indicators are. And you can tell between the as of date, right? This is as of 2/1, whereas this is as of 7/1, because it has that 6-month maturation period to be aware of. Okay. And then one other thing that I do want to point out here is, yeah, it has also this helpful text here to let you know when these were run and why it's an intentional 6-month lag. All right, so then when we look at our next set, let's talk about some of the new quality indicator sets. So new quality indicator sets, so here's an example of the vital signs dashboard adult and the vital signs dashboard child. So these new indicator sets, these are also replacing the previously existing general medical quar DOH performance tracking measure. And the measures within the set were relocated into these vital signs dashboard indicator sets to provide more specific information in relation to vital signs. So the majority of the VSD indicator set measures are run, and that's why they're listed in that performance tracking set, because the majority of them are listed in the performance tracking set, because there is a 6-month data maturation period to allow for those services to be invoiced. There are also, I think there are about maybe three to four indicators within those sets that are going to be the real-time measures and are run monthly. So that's something to keep in mind as when you're looking at the vital sign dashboard indicators, that there could be 3 or 4 of those indicators in between the adult and the child that are going to be run on more of a on the monthly basis versus the 6-month maturation. And the hover over text will let you know that specifically, as well as if you download the definitions list. So here's what the hover over messages include. So for example, for the adults, this is going to be right here, are run monthly after a 6-month maturation period to allow for services to be invoiced. These measures are calculated for a 12-month period. Measures run monthly on all available data as of the run date do not require a 6-month maturation period and will be indicated in the hover over text. All right, so as I mentioned before, that's where that information is going to live. It's going to be in the performance tracking indicators. You can see here there's the adults versus the child. Okay. And going over here, here's another example. So this is an example of one of, and this happens to be in the child version. This is going to show that the quality improvement indicator run monthly on all available data as of the run date. So this is letting you know specifically that this is one of the measures that's going to be quote unquote more real time versus having that 6-month maturation period. All right, I'm just going to pause here briefly to check in with Jane and Rachel to see if there are any questions.
Hi, yes, there are a few questions about the social determinants of health data, and basically asking if there's a way to extract data for the entire population, like such as in the recipient search, rather than just the clinical summary.
That's a great question. Thank you so much for asking it. So that is actually something that we're going to have in our next release. So that's going to be available in June. And we're going to provide a way in the recipient search level for you to be able to search for a specific domain or a condition. It's not available right now, but it will be available in our next release.
Okay, perfect. That's all we have right now.
Okay, great. So I will move right on to core eligibility. I'm just seeing that there's no sound. I apologize. I was still on mute. Thank you so much for letting me know. All right. So as I was saying, the core eligibility and the report filters in the clinical summary, this is following the transition of some of the adult home and community-based services to community-oriented recovery and empowerment, also known as core services. So what we've done is we added a few different options within PSYCKES for you to be able to identify and understand more about your core eligible population. So first is in the recipient search. So this new filter, core eligible, will be displayed in the characteristics section within the existing high need population filter. It's going to be located right up at the top. So if you're looking to see who at my organization is eligible for core services, that could be a way for you to run that. Additionally, we've added 2 new columns called Core Eligible and the Managed Care Product line to the Care Coordination Advanced view. So if you're running an ad hoc report and recipient search about a particular population or subgroup of your clients and you want to add the Care Coordination Advanced view, within that view now, you're also able to see those who are core eligible as well as who their managed care product line is. And then lastly, we have the clinical summary. So when applicable, the client level clinical summary will show the core eligibility message in the current care coordination section. And it'll also allow you to go into a separate window to view more information about core itself. So here's what it looks like in the recipient search, high need population. Right up at the top there, you see the core eligible. So that's how you could run your search to identify those folks who are core eligible. Here's an example of what it looks like when you land on this report and you decide that you want to look at the care coordination advanced view. So right now what we're seeing here is the standard view. But if you want to change the view to care coordination, you can come right up here and change that. And you'll see that we now have the managed care product line indicated as well as the core eligible. And the core eligibility criteria applies to those who are 21 and over, and the logic, I should mention, of this filter here when it comes to the core eligibility includes recipients if as of the refresh date, so here's the refresh date over here, if they're hitting either an H1 or H4 H codes or are hitting an H9 algorithm and are enrolled in a MAP product line, that's who are going to be considered within this logic here. So that's also a reason why we wanted to make sure to include the managed care product line over here as well for folks to be able to see that. All right, and then we come to the clinical summary. So let's say, for example, this is an indication that this person, happens to have this eligibility. So the logic for this message will include recipients if, as of the refresh day, they're hitting those H1 or H4 H codes, or they are hitting the H9 algorithm and enrolled in MAP. So you can tell right from the top up here, here's the individual's HARP status. So if they have the H1 or H4, that'll be indicated up here. Or if they happen to have the H9, you can always check the product line over here. So in this case, this person has H1. And then here you can see the core eligibility, that this person is eligible for these services. And for more information, you can visit this. So here's in the brief. It's also available in the 1 and the 5 year as well. This is what happens when you hit that link. It's bringing you to the core overview for you to have more details. All right, let's talk about new service settings. So this new service setting for the crisis services for intellectually and developmentally disabled. So that's the CSIDD. So we added these as a new service setting to allow users to filter their reports for clients served in this specific setting to assist in population health management, as well as to review treatment history and service utilization using the clinical summary. So in the recipient search, you will see in the services by specific provider or services by any provider section, there's this new CSIDD crisis service-DD filter, and it's available within the service setting box underneath the crisis service category. For program type filters, if you want to filter a specific report by this type of service, in the MyQI report or the statewide reports, you would find the CSIDD crisis services DD available in the program type filter dropdown. And then lastly, in the clinical summary, if applicable, the CSIDD crisis services DD will be displayed in the hospital, ER, and crisis services section. So let's take a look at what this is. So we're going to see here that we have underneath crisis services. So if your organization itself does not provide this service, you wouldn't see it under your service name. You could also find it under services by any provider. So that would be a little bit lower on the recipient search. But for example, my Main Street Mental Health Clinic happens to provide this service. So that's why I'm seeing that here under the service setting. Here, if my filters for program type, if I want to filter my QI report to identify only those who are providing this service to, get a better understanding of that population, I could do that by coming into the program type here. And then lastly, this is the statewide report also here. And then lastly, we have the clinical summary. So this would show in the brief as well as the one in the 5-year. So here's an example of the hospital, ER, and crisis services. And here's where that's listed. And you can see the service type, the provider name, admission, discharge, length of stay, most recent primary diagnosis, and procedure. All right, now let's talk about the new region filter that has been added. All right, so the new region filter and recipient search underneath the characteristics, and they're defined by the 5 OMH regions. So Central New York, Hudson River, Long Island, New York City, and Western New York. So the regions are based on the county of fiscal responsibility, which refers to the county where clients are registered to be having Medicaid funds. It should be noted that whenever region is selected, only counties within that region will become visible and selectable within the county filter below. And the region filter will be updated regularly in the application. So it's always going to be reflecting clients with that assigned county of fiscal responsibility and respective region as their most recent county, and therefore thereby grouping them in a respective region. So there should be no duplication. A client should never be in 2 region buckets. And you might notice as well that the existing county of fiscal responsibility filter has been just renamed to county. So here's what it looks like in the application. Here's the region. Like I mentioned before, when you make a specific selection of a region, that logic is going to impact the county filter below. So I'm selecting Hudson River. So now when I look at county, it's only going to show counties within that region. All right, so before we switch to the live demo, I'm just going to pause here once again to see if we have any questions.
Hi, Kristen. There are no further questions at this time.
Okay, great. So I'm just going to go ahead and try to switch over as smoothly as possible. All right, so I'm going to.
Oh, actually, we did just get one.
Okay.
If while you're switching, we want to answer.
Yeah.
We got a question about member population. So is there a difference between care management enrolled and health home enrolled populations?
So there shouldn't be a real difference. If someone's enrolled in a health home, they should be enrolled in a care management agency. I'm sorry, I might have been multitasking during that question. Was that the specific part of the question, or was there more to it?
Nope.
Okay. So I think folks should be able to see my screen. I'm just going to see if Rachel, you don't mind, or Jane, you don't mind just checking that you're seeing my iPad on my screen right now.
Yep, we can see your screen.
Yep.
Okay, great. So we're going to do a live demo right now of the application, and I'm really excited to talk about these great new features that we have available in our iOS app. And for those of you who aren't aware, we do have PSYCKES in an iOS version. And what's great about this is that you're able to take like the clinical summary or the PSYCKES on the go, basically. When I actually do my password right, sorry. So what you're able to do is you are able to be out in the field. And when you think about like people who like might be doing homeless outreach services or crisis services, being out in the field without having to bring, a laptop or, bunch of papers, they're able to, pull up the clinical summary with the individual, right there and then. But one of the things that we realized is that if we were trying to like make this process easier, wouldn't it be great if someone would be able to electronically sign the PSYCKES consent form? And this is why I want to bring this up right now, is that this is something that's only available in iOS, the ability to e-sign. And like what we're doing currently right now in the web version of PSYCKES is that you have the client sign the PSYCKES consent form, they're provided a copy, and then somebody, it could be the same person or it could be a different person, then have to go into the application and attest that the PSYCKES consent has been signed. So it's not as streamlined of a process as if someone could e-sign the consent right within the application. So that's what we're going to be practicing right now. So I'm going to look up a client, and I'm going to look them up using one of their identifiers, like a Medicaid ID or a Social Security number or a name and date of birth. You'll notice that this information has been scrambled because it's a live demo, but basically what I would do from this situation is I would check their name, their Medicaid ID, date of birth, and confirm, yep, this is the person that I'm meeting with right now, and I want to be able to look at their information, and I want them to be able to sign the PSYCKES consent form. So I'm going to drill into that. And then again, this is just another place for me to confirm that information. I'm going to go ahead and hit Enable PHI Access. So this is the brand new thing that we just added. Right up at the top here is the e-sign PSYCKES consent feature. So this is where I can be meeting with a client face-to-face out in the community, and if they agree, they say, yep, I'll sign the PSYCKES consent form with you right now. This is the process in which you can follow. So I'm going to go ahead and select this top option right up at the top here. And the first screen I'm going to see is an overview, right? So the first thing I need to do is confirm the client's identity. I need to review the consent form with the client. The client will then say that they give consent or deny consent. And then if consent is given, the client will be able to sign on the screen. After the client signs, so I'm logged in right now as Albany Medical Center. So signing the PSYCKES consent form with an e-signature or a physical signature is going to give you the same level of access, all available clinical summary data for 3 years, and it renews automatically with each billed service. The completed consent form will be available to view in the client's clinical summary in the plans and documents section. So that's something that you'll want to work with the client on, providing them their copy. If it's something that, now that it's going to be available within the plans and documents section, you could provide it to them when they come to your office, or you can email it to them, or whatever your method for, sending this information or providing copies to clients is. And that's what the last bullet's pointing at. So I'm going to go ahead and hit next. So how do I know this is the correct person? Just like with attesting to any of these other options, you have to either indicate that you're attesting to the client identity, or the client presented one photo ID or two forms of non-photo ID. So I'm going to say the client presented me some photo ID. I will make my selection of what that was, and then hit next. So now we're on the part of reviewing the PSYCKES consent form. So the PSYCKES consent form is now available for reviewing. So this is something that you'll want to go over with your client, give them all of the details about this. And then once you've reviewed that, that's when you can go ahead and hit next. Oh, I do want to mention one thing. If your organization has not set up their provider details in the web version of PSYCKES, so what does that mean? That means that you have provided contact information within the registrar menu of the PSYCKES web application to indicate who the person or staff is if there's been improper access to client information, and then who the staff is for withdrawing your consent. So you can see here, for example, these are right here, fake names like Jane Doe and John, or John Doe, right? So this information must be filled out within the registrar menu of the web version. If you don't have it filled out, then you're going to get a message saying that that needs to be completed. So that's just something before you're using the e-sign consent, you want to check your registrar menu to make sure that that information's been filled out appropriately. All right, I'm going to go ahead and hit next. And here's where the client will either give consent or deny consent. So at this opportunity, I'm going to go ahead and say that me, John Doe, is giving consent for Albany Medical Center. When I hit next, I have to indicate now, is it me who's signing, or is this a legal representative for John Smith? So I'm going to say this is John Smith. And again, we de-identify because this is a training. So I'm going to go ahead and say, I'm John Smith, and I'm the one that's signing this consent. I'm going to go ahead and hit next. And then here's this open screen for me to be able to sign. Now, I do want to mention right now that I'm on an iPad, but you could be on an iPhone, right? You just have the space to sign, just like we're probably used to signing all the time in our lives with, signing bills and all that kind of stuff. So here, I'm just going to go ahead, right? And if I decide right here, switch my screen really quickly. If I decide that, oh, you know what, I don't like how that looked, I always have the ability to clear. So now I can sign again. And dot my I, there we go. And now I can hit next. So what happens now is that if I hit confirm, that means that this consent is going to be added to the plans and documents section, and then I'm going to be able to go right into the clinical summary. So I'm going to go ahead and hit confirm. Right? So now I'm all set, and work with your provider to discuss options for receiving your copy of the consent. So I'm going to be, as the provider, I'm going to go ahead and view the clinical summary now. So some of the things that we've added to iOS, not only the e-signature capacity, but we also added some of the features that we were discussing in the clinical summary in the web, right? So for example, here's somebody who's getting that core eligibility message. We have that available now. Another thing I do want to mention is going to be in regards to the lab. So that's not the labs, over here, the lab results. So folks might have remembered that in a previous release, we added lab results. So we have lab results coming from the state psychiatric center. So if there have been labs that have been conducted there and we have access to it, we're able to show that in the web version. We also have this ability to look for it in the iOS version of PSYCKES now, which is something that's been added and it's brand new. So if an individual has any lab results from a state PC in the past year, we'll be able to display it here. And you can see from left to right, we're seeing the name of the test, how many of those tests the person had in the past year, when was the most recent test, what were the most recent results, were they low or were they high, and then how many abnormal tests has this person had. So for example, in this row right here, the hematocrit, I'm going to totally guess on that pronunciation there, we see that there have been 5 tests overall, but 3 of which have had abnormal results. So if I wanted to go in and I wanted to see all 5 results for this particular lab, I would have the ability to do that. And then also on the far right, I should also mention that the normal range is included, so you have an idea of what's considered normal or not. So let's look over here. So we can see that out of the 5 times this person had this particular lab, we see that 3 of the times they were considered low. And if we keep scrolling down, we can see there's more options to that. Yeah, so that looks like that's one of the only, or here's another one for hemoglobin. That was another example that they had a low hemoglobin in the past. Okay. So that's a new section that has been added as well. I'm going to go ahead and now I'm going to maneuver my way back to our PowerPoint. I'm going to stop sharing here and get myself back into my PowerPoint and talk about some of the training and technical assistance that we have available. So I'm going to start the slideshow right from where we are. So we have a lot of training materials for our users on our website, the PSYCKES.org website. So you have the option of either joining, like you did today, a live webinar, by registering on our PSYCKES training webinar page or responding via an email that you might have received in regards to a refresh. But then we also have recorded webinars, and these are great resources, especially if you're brand new to PSYCKES and you're just trying to learn a little bit more and you want to make sure that you know how to ask questions about the information that you're seeing. It's a really great idea to make sure that you or new staff are looking at this information. So using PSYCKES quality indicator reports, right? That's going to have a brand new look to it now that we've seen that we've done this division of that section, and we're also going to be adding in some new DOH measures. So that's going to be a great training for people to utilize. Navigating PSYCKES recipient search for population health. If you want to be able to run ad hoc reports to really identify, cohorts of interest, that's a great training webinar. Using the PSYCKES clinical summary. The clinical summary, as I mentioned, has 5 years worth of clinical information for clients. And it's a lot to get into. There's a dozen or more sections. So this is a really great in-depth way of learning how to use the PSYCKES clinical summary to do your care coordination, your work with clients. Then we have the consent emergency quality flag, PSYCKES levels of access. So it's really important, especially as a provider, to understand the levels of access and what you are able to see, what you're not able to see relative to the level of access that you have. We obviously think that the PSYCKES consent is the gold standard, right? That's giving you the most information for the greatest length of time. So when you are able to get a PSYCKES consent, whether it's a physical or in this case that we were just displaying the e-signature, that's an example of how that can be useful there. And then the PSYCKES mobile app for iPhones and iPads. Maybe you weren't aware that we had an iOS app, or if you did, you might not have found it as useful. But now with this e-signature component, you can think of all different ways to use that, especially out in the field. So that would be a great training webinar to join. The introduction to PSYCKES, where to start. Those are really good for beginners. PSYCKES Train the Trainer. And then we have our MyChoice consumer access. So for clients who are interested in getting access to their own health information, how to get them set up within their MyChoice to look at their treatment data. So basically it's the client's version of the clinical summary. And then we have user guides and short how-to videos. If you want to just, try to remember how to enable a consent, or you're having difficulty logging in, those are great training materials for people to utilize. The self-service console. So this we keep including in our slides, even though it's been, it's been almost a year now since this has been implemented. But basically the self-service console is a way to manage your RSA token and PIN for logging into secure OMH applications, including PSYCKES. And you can access it at mytoken.ny.gov. So it's there that you are setting your security questions. And if you have set your security questions, that's where you can go ahead and reset your PIN. So instead of being beholden to the ITS help desk, you would be able to reset your PIN yourself. Activate token. So if you're brand new or you lost your phone or you lost your token, to get a new token, you're going to be activating it within the mytoken.ny.gov. And that's also where you can request a replacement token. So this is exactly the console that needs to be used for any new users since the past year. So it's just something to keep in mind. So the help desk support. So our PSYCKES help desk, just great team that we have. There's somebody's responsibility each day to take a shift and come and get all the questions across the state about the application. It's available 9 to 5, Monday through Friday. So this is a great opportunity when you're reaching out to the PSYCKES help desk if you have a question about the functionality of the application, or if you have a question about the data that you're seeing in the application. So that's where our PSYCKES help desk can be the most useful in regards to your inquiries. Now, we do know that there are often questions about how to log in, authentication errors, how to get a token, how to get access, all of these kind of things. So in regards to like token and login and then the SMS support, you happen to be a security manager, because PSYCKES is only one of the many OMH applications, login and token related things, which they all require, those need to go to the ITS help desk. And depending on what type of user you are, you might have a different help desk. So the provider partners who are not OMH employees, so pretty much anybody but an OMH employee, would contact the help at its.ny.gov, and there you can ask for assistance with your logging in or your token, right? There is a phone number, but I do know that they do prefer email, and they do get back to people a bit quicker via email, so that's why we always emphasize that here. If you're an OMH employee, you have your own help desk, the ITS help desk, and that's at fixit@its.ny.gov. So again, if you're wondering why you don't have PSYCKES access or why your token isn't working, that's a great place to start. But again, if you do reach out to the PSYCKES help desk, we are more than happy to be the middleman to help make sure that you're getting the access that you need. So with that, I'm just going to open it up to see if there are any other questions in regards to today's training.
Yeah, so we have one question about the iOS version of consent. And so they asked, if an individual signs in the iOS version, how does it transition to an organization's ECR? What
was the acronyms again?
It was ECR. It might have meant to be EMR.
Yeah. So in regards to how it relates to PSYCKES, so if you get a client who signs the PSYCKES consent form, and that's something actually, let me see if I can stop sharing. I should have probably made sure to identify that. So I'm going to go back to my original screen of back in this WebEx, share that once more. I'm still logged in. All right, so let's go to here. All right, hold on. Oops. Let me just make sure. Are we seeing my screen for the iPad?
Yes.
Awesome. Okay, so for plans and documents, so you see here, this is where that, oh, I have de-identified on, so we can't look at it. So this is where you would be able to see the PSYCKES consent form. So after getting the e-signed PSYCKES consent form, you have the ability to look at it within the plans and documents section. So in relation to your own EMR, that's something that you could always download, right? You can open this up, download it, and add it to your EMR yourself. So that's where that would exist. It's not going to automatically add it to your EMR, but then again, this is also, you won't have to have someone, you know, if you're out in the field and you're able to, you know, do the e-signed consent, you can do it all within one streamlined process. There isn't a process of like, okay, you sign the consent over here, and then me or someone else is going to go into PSYCKES and then actually attest that you signed the consent. I hope that answered the question.
Yeah, I think so. I think someone just reiterated that it's important sometimes to have a copy of the consent. So that makes it clear that you can have a copy.
Yeah, absolutely.
And then another question was if e-sign will ever be added to the regular PSYCKES platform.
Oh, such a great question. So that is definitely something that we are hoping to have available in the future. We don't have a time frame on it right now. The way that iOS, the mobile app worked, it was relatively easy to build there versus in the web version, but we'll definitely make sure all of our users are aware when and if that is available.
And I think that's all the questions we have.
Okay. It looks like someone's raising their hand, but we don't have the ability to unmute you. So if you do have a question, I would suggest just writing it in. It looks like I see a question that's coming into the chat. So I think that might have been the reason we might have missed it before. So can the token only be used on the mobile device? So I think just to understand a little bit more on that question, I'm going to try to answer it the best way I can. So we do have, so for the RSA token, there are a couple different options. So the RSA token, especially if you've been granted access in the past year or so to PSYCKES, The RSA token is available via a mobile token, which you can have downloaded onto your device. And the RSA token, I should add, can be available like on an Android, I think even a BlackBerry or iOS. Our PSYCKES app specifically is only available in iOS. So the token itself isn't designated to just iOS, but our PSYCKES iOS app is. And that's because we have an iOS developer. Security-wise, iOS passed our needs for that because this is protected health information. We are in the future hopefully expanding to Android, but that's not, that's not happening at this time. But in regards to this token can only be used in a mobile device, you have the ability to have your token downloaded onto your mobile device. You also have the opportunity, so there are some, let's say, hospitals that don't allow to have mobile devices on the floor. You also have the option of selecting a hard token. So that could be done by your security manager when they're first requesting your PSYCKES access, or it could be done when you're requesting a replacement in the self-service console. There's an option to choose a hard token, which almost looks like a keychain, or the mobile token. And I see that there was a question, will you email or send a link to watch this training? So if you have been listed as an attendee in this training, you will get this training recording as well as the slides, but we'll take special note of this user right here just to make sure that they're definitely included. All right, so I don't think I see, let me see if there's anything else here. No new questions that I'm noticing. So I think I can give people a couple minutes back to their day, but as I mentioned, the slides and the recording will be sent to all attendees, and then we will also post it on our website at a later date. So thanks so much for joining, and looking forward to folks utilizing some of our new features. Thanks again.